All right, so I just wrapped up my red light therapy, so I'm just going to take this off and set this to the side. And the next thing we're going to do is the nerve spa. So the first thing I like to do is grab the bucket. I'll fill this up with warm water. Some of my patients do like cold water. Most of them do like warm water, though. Make sure it's not scalding hot is the biggest thing. You'll see this little ridge on the side. Fill it up to at least that part there. And then what I'll do is I'll set it on the ground right in front of my chair, my recliner, wherever you like to sit when you're using this. It is a 30-minute treatment, and you don't want to take breaks in between it. We want to do 30 minutes continuous. Once you have the water sitting there, you have a little bit of Epsom salts. So you're just going to put a teaspoon or two on each side. And then you can just twirl it with your finger there, or even put your feet in there. You can move it around just to help mix that up a little bit more. The other thing that we're going to want to do is you have some of these effervescent tablets that come with. You'll go ahead and just take one tablet and drop one tablet on each side. That will dissolve itself. Once again, you can move it around with your finger a little bit, or you can put your feet in there and move the water around just to help that mixture absorb completely. It helps with the conduction and also aids in the health of our feet. So once that's all set, that mixture is ready to go. I make sure I put my feet in there, and then you grab your unit. Your unit does come in a traveling container. That way it just protects it, especially if you do have to travel around with it, which a lot of my patients do. Some of them go down to Florida, for the winter. They can take this with them very, very easily. So on the right side of the unit, all you would do is just hold that for about 3 seconds there, and you'll see that kick on. Now you do have 2 ports, channel 1 and channel 2. If you're just using this for the feet, you only have to put in one channel. So I just put this one into channel 1. The reason for that is it does split into these 2 wires. So what I'll do is I'll put one of the electrodes on one side, the other electrode on the other side. You want to make sure those are completely submerged. It's okay if it's touching your foot. It's okay if it's not touching your foot. The first couple times you use this, you might not feel much, so you have the arrow buttons. So I'm just going to click this up to a 3. Most of my patients don't go over a 3 the first couple times. The reason for that is we just want to get the body used to adding in this stimulation. So if ever my patients have a flare-up when they start treatments, it's because they have this thing turned up too high. So slowly work your way into it. This treatment should never be painful. It should always feel very comfortable. But as you start to get used to it, we want to start to kick it up a little bit more. So you start to feel a good stimulus. So when I say stimulus, you should feel like an electrical current going through those feet to really make sure that we're refiring those nerves to get them retrained, to get them feeling better again. So 30-minute treatment should never be painful. Now, of course, if you have any questions with this, if you are getting a flare-up or anything like that, which doesn't happen often, make sure you reach out. That way we can troubleshoot this for you to really get you back on the right path, to make sure that we get you feeling better and help you achieve your goals, the whole reason why you came in here. After 30 minutes, it will turn off. Just make sure the unit's turned off. It does have a rechargeable battery in there. The kit comes complete with the charger and everything, so all you would do is just plug it into the wall, and then it will charge overnight or until your next treatment. When I'm done, I usually have a towel next to me, so I'll just wipe off my feet real quick. I'll go dump out the water, and then I'll just have to make sure that it's all set to go for my next treatment, either later that day or the next day. If you have any questions with that, just go ahead and reach out. My front desk can help you, and even I can hop on a phone call with you to make sure that we're doing this properly. Hope that helps.